Thank you so much. Thank you for the invitation. It's my second time in Doha. And I have to say that it looks like in the UK for the training session in the afternoon, so everybody disappears. So the main question is, can we use electrical steam and electrical steam of muscles to improve recovery? And I will have a first introduction on the topic because I consider we need some assumptions before moving to the main and scientific probably part, finishing with a practical part. That is, do we really need recovery as a general word? So this is what you can see if you go on the web, if you buy a magazine, if you watch the TV or whatever. You usually see very good cyclists, like for example in this case Mark Cavendish, who won only a few weeks ago the Tour of Qatar, who clearly says, and that's on the internet page of one of the main stimulators, I use recovery because it's the key to success. I use my stimulator to get back in shape in no time. It helps me to recover faster and helps me to train more efficiently. So that's everything about that. So what's true? And we'll see in a very pedagogical way what's the best approach to that. Assumption number one. We already spoke about that, and I appreciated a lot the talk of Martin, because so we deal with sport performance, and we are all interested in improving sport performance. And as you can say, as you know very well, sport performance is affected by different functions. From my side, it's mainly the neuromuscular function. From other sides, the psychomotivational function. Many other factors contribute to that. And the assumption number two, the logical assumption, and that's what we saw this morning also with Greg. At one point, we have a decline in sport performance. And I think it is important, as Martin said, to ascertain there is a decline in sport performance or neuromuscular function before asking the question, do we need recovery? So on one side, you have a decline in neuromuscular function, what we also call neuromuscular fatigue. And we have more and more papers also in this direction showing sexy results also in athletes about central peripheral fatigue and so on. And this affects directly sport performance. On the other side, I am not a psychologist as any other person that presented before me. But the more I do physiology, the more I have to admit that psychological, psychomotivational parameters are essential for performance. There is a huge interaction between the two. I do according to what I feel. And those two main parameters have an effect on sport performance. And that's exactly what you have when you have a fatigue. So a decline in sport performance, a decline in neuromuscular function, a decline in psychomotivational function due to competition, due to training. And that's the point. So do we have this decline? Yes or no? For example, in kids, we have no decline. That's what we saw with Martin. In professional soccer players, we have this decline. So we need recovery. And the recovery is the following phase. So we need to bring this as fast as possible to the 100%. The same for psychomotivational factors. And one more time, I want to insist on this second part here because I have the impression that there is a sort of psychosis around the recovery in sport in the last few years. And why don't we have a decline in performance and recovery is not a problem for kids? Because they don't care about recovery. Why in soccer players that are one of the athletes who receive the best care, do we have this decline and then they want to go back and they have a sort of, okay, I don't feel well if I don't recover. And why we have no problem with the NBA, with professional ice hockey players who play every second, third day, who travels a lot. So what I just would like to say, there is a sort of psychosis around recovery. That's what I believe. And that's why this part is very important, because I feel well, I feel recovered, therefore I don't expect any injury. I don't feel well, I feel I had to do a session of cryotherapy, whatever, I didn't do the session, I feel I can have an injury. But that's mainly for me on this side, not very much on the other side. And that's against my nature, because I am an exercise and a muscle physiologist. So we focus on recovery, and the main question of my talk would be, can electrical steam, and ES in my talk will always be electrical steam, not effect size, help to restore neuromuscular function and or psychomotivational function after exercise? In other words, Is electrical stim beneficial for physiological recovery? So let me simply call neuromuscular recovery physiological recovery, and the psychomotivational perceptual recovery, my sensation of having recovered or not. That's the main question. So we will focus on different forms of electrical stim that maybe you know better than me. You know that there is current that is injected into your skin with the aim to reach muscles or not, depending on intensity. We have specific parameters that are usually overused to make assumptions on the effects on specific receptors, specific afferents, and so on. And the idea is, in this case, by imposing a contraction that is very unnatural, because let me say one thing that is clearly known, is that contraction imposed by electrical stim to the quad, for example, is completely unphysiological and completely different from the voluntary contraction. The main point is that we activate the superficial part of the muscle, and we activate just a small portion of the muscles. And the second point is that there is discomfort. Not all the people like it. The majority of people do not like it. So how can we expect better recovery from a technique that activates only a small part of the muscle and that creates discomfort? So let me try to see these points. And that's the basic definition of electrical stim. So you can find different thresholds here, what we call thresholds. This is the intensity. That's the only parameter when you buy a stimulator that is exactly like this one, that you can modulate online. Plus and minus, that's the intensity. And according to the intensity, you will first have what we call MENS, or microcurrent electrical nerve stim or muscle stim. And this is a subsensory, so we have no sensations. We apply some current, we have no sensations at all. Then we increase again the intensity, and that's an example for the quad with a constant current stimulator. We reach a sensory threshold, which means we feel something, the muscle is not moving. That's the sensory threshold. And that's the typical application of TENS, transcutaneous electrical nerve stim, for treating pain. And then you increase again. And then you see your muscle twitching, with some parts of the muscle twitching, and that's what we call the motor threshold. And then you increase again the intensity. Your muscle is really contracting with a more and more intense strength. Finally, you go to the pain threshold, so you start experiencing some pain that is not very good. But then, I mean, there are many applications of electrical stim, and the most effective one today, for example, with patients in intensive care units, are with these kind of currents. That's not the topic today. The topic today is just to focus on the two main forms of electrical stim, so the sensory one, also called TENS, and the motor one, also called NMES, to have an effect on the perceptual recovery for the TENS, so mainly treatment of pain, soreness, whatever, and mainly an effect on the physiological recovery for NMES. And then you have these tons of parameters that, again, for me, these are just part of the speculations made by commercial companies about the potential effects of electrical stim. As the previous speaker, I would like to tell you that I have no conflicts of interest at all, besides a consultancy agreement with Novartis, but not for electrical stim-related research. And I'm not here to tell you if you need to use or not electrical stim. I'm here to tell you the evidence we have for recovery. So let's split in two parts, physiological recovery and psychological or perceptual recovery. That's physiological recovery, the theory. The theory, does it work? Yes. The theory is when we apply this kind of current, so at motor intensity, so your muscle is twitching, you'll see the muscle contracting. The idea is to promote blood flow, increase venous blood flow. This will in turn help for metabolites removal, substrate availability, and decrease maybe inflammation. And this will in turn improve the neuromuscular function. That's the assumption behind neuromuscular electrical stim. And the assumption behind perceptual stim and perceptual recovery is that if you apply TENS or MENS, so the microcurrent, you play on two mechanisms. One is the well-accepted theory of gate control, published almost 50 years ago in Science. And the second is a strong placebo effect. Whenever you apply stimulation to a muscle, you are playing with a placebo effect. In turn, these neurophysiological or psychological effects will reduce maybe pain and soreness due to exercise, which will in turn improve maybe the perception of recovery and the perceptual function. These are the assumptions behind electrical stim. let's go back again to the physiological now. So let's jump from step to step into these three main ideas with the evidence. So what's the evidence? When we apply electrical steam, like here, to the quadriceps muscle, that's a very old study. I mean, these are the pioneers for electrical steam and blood flow. And the poor thing is the number of citations, as you can see here. So the papers using electrical steam for recovery have more than 50 citations today, and they've been published less than 5 years ago. The papers on blood flow, so the basis, the background of electrical steam, have received very few citations in more than 20 years. Anyway, electrical steam improves blood flow. As you can see here, with different frequencies, so subtetanic, quasi-tetanic, and tetanic, blood flow increases from rest to higher levels, which are not spectacular, while applying electrical steam. One strange thing you can see is that the blood flow increase is greater for the 50 Hertz, which is actually not the frequency mainly used today for recovery, compared to 1 to 20 Hertz. As you can see here, there's a progressive increase in blood flow. That's quite contrary to what we know today from the commercial side, certainly. The second important message from this second paper here, who is even less cited, is that voluntary contractions produce a greater increase in blood flow compared to electrical steam. That's electrical steam of the plantar flexor muscle. These are voluntary contractions of the same intensity, and you can see that the increase in blood flow is much greater for the voluntary contraction compared to electrical steam. So already there is evidence to say that blood flow increases, but not as much as voluntary contraction. That's another paper, very well done, published in one of the main journals, so John Applied Physiology, 4 citations in 3 years. And that's not normal for me. And the idea here is very simple. So 4 conditions, 5 if we consider the rest condition. So this is the WB, weight bearing. This is 2 curl contractions. This is electrical steam to the foot, to the popliteal vein in the foot. And this is a pneumatic compression applied to the same vein. And you can see here the, let's say, the blood volume to simplify. In the different conditions, so you see a huge difference between the weight-bearing condition, the voluntary contractions, which is 3 to 5 times greater compared to electrical steam, which is almost the same as voluntary contraction. So the increase in blood flow is not that spectacular. And now people say, okay, let's look at lactate. Somebody already said that lactate is not the best way to look at metabolites removal, and I agree very much. But there have been studies in the last 10 years focusing on lactate after different kind of recovery. Electrical steam is blue, passive is black, active is red. Not surprisingly, blood lactate decreases more for the active conditions compared to electrical steam and passive, with no difference between electrical steam and passive for lactate removal. Same message after a swimming exercise. So this was simulated in a lab for triathletes on a cycling ergometer. This is after a swimming session, but the message is the same. Lactate removal is faster for the active and swimming recovery versus electrical steam versus resting recovery. And now if we try to put that into sort of evidence, so I apologize, that's not a forest plot for people who know statistics. That's simply an idea that you can see here about electrical steam versus passive. So that's not effect size, that's electrical steam versus passive. Electrical steam is less effective than passive, equally effective than passive, more effective than passive. With the different studies having done that, the study without the data, the study done in our lab, where you can see that out of 6 studies where electrical steam has been compared to passive, lactate removal was equally effective or more effective than passive. While, if now you look at the other conditions, so electrical steam versus active recovery mainly, in 4 out of 5 cases, electrical steam is less effective than active recovery to promote blood lactate removal. Is that clear for you? Is the presentation clear? Is this presentation clear for you? Good. Some people also said, okay, this can in turn reduce the inflammation. There's been a study that is in press in International Journal of Sport Physiology Performance, was focused 2 markers of inflammatory response. And again, no difference between electrical steam in black, water therapy in white, and control or passive in gray here. So it is not true that we can really have an effect or reduce the inflammation after the application of electrical steam. Some other people, okay, let's say creatine kinase is a marker of muscle damage. I don't completely agree it is the best marker of muscle damage, but let's look at this. Even with very aggressive treatments, so these are like 90 maximal contractions, eccentric contractions of the hamstrings. Look at the concentration in creatine kinase. I think one of these people had rhabdomyolysis, so breakdown of muscles, proteins. Anyway, if you apply passive recovery after this kind of crazy exercise, which has nothing to do with sport, and electrical steam, you only have a trend, or if you want, as those authors here said, a significant difference between electrical steam and passive condition only 3 days after the exercise when the maximal concentration of creatine kinase is observed. And then in another study, which is, in my opinion, more interesting, so that's done by the team of Timothy Noakes. That's done by using MENS, so microcurrent electrical steam. That's not done by using any stimulator. That's just a membrane called Acoustat that is on the market, I guess, which you apply after exercise, and you keep it for 48 hours after exercise. In this case, this was used 2 times, so 2 times 48 hours. And you can see here the time course of creatine kinase activity after the exercise for the condition with MENS versus without. And you can see a very significant difference between the 2 conditions starting from 96 hours. So there is some effect indeed. And if we look again with this kind of presentation to the 3 studies, we have compared electrical steam versus passive for creatine kinase concentration. 2 have shown that it is more effective than passive. 1 has shown no significant difference from INSEP, no significant difference between electrical steam and passive exercise. And the only study just published in the International Journal of Sport Physiology demonstrated that electrical steam is not significantly different from compression alone in professional rugby players. And finally, if you look at neuromuscular function, which is basically the main outcome you can quantify. So basically, these are data in which muscle strength, isometric, eccentric, concentric, whatever, with validated methodologies, has been tested in black, where performance, anaerobic performance, jumping, sprinting, rowing in this study, has been quantified in the lab. And you can see that for all these studies, and there are many studies, all the studies tend to show that electrical steam is as effective as passive recovery for restoring neuromuscular function. Only in 3 studies there have been a greater effect of electrical steam compared to passive recovery. And now if you compare again with other form of recovery, so that's mainly active recovery, you can see that almost all the studies but 1 demonstrated the same effects of electrical steam versus other modalities on physiological recovery and the recovery of muscle strength or anaerobic performance. Let's turn the page. Let's move on the psychomotivational side now. And one more time, I will be faster and move from one to the other sections. So the assumptions behind perceptual recovery is with electrical steam is partially based on this gate control theory, which is basically a mechanism taking place in the dorsal horn of the spinal cord with the interplay between large and small afferences, where there is a sort of inhibition of the pain thanks to the large afferences stimulated by the current. That's the theory. It has been demonstrated more than 50 years ago. There is a theory behind endorphin liberation with electrical steam. That is also a theory that is not commonly accepted by all the scientific. But what is more likely accepted, if you read electrical steam studies, is the placebo effect. So in almost all cases, you have a strong psychological influence just to position electrodes and tell to somebody, okay, it will be effective for you. You watch that on the TV, it is effective, don't worry. Okay, can this form of exercise reduce pain and soreness? This is a study conducted in France by Vincent Martin 10 years ago. By comparing DOMS, so delayed onset muscle soreness, after eccentric exercise, followed by 3 kinds of recovery. This is running, course à pied, electrical steam, and control. And you can see no differences in the time course of DOMS with the 3 modalities. This is another study conducted with by the team of Frank Pizza, where you can see a difference in DOMS after extreme eccentric exercise for the elbow flexors. Only, you can see here, 24 hours after exercise. And that's the only message telling you that electrical steam was more effective than passive for DOMS. But the delta changes in DOMS were not significantly different. Now let's put them together in this evidence presentation. So electrical steam compared to passive is equally effective. Only in 3 studies, it was more effective than passive recovery for minimizing DOMS symptoms. And if you compare electrical steam to the other modalities, mainly the active modalities, in all the studies but one, Tessitore, with the junior team of Roma soccer team, found a beneficial effect and more effective electrical steam effects compared to active recovery. And then let's look at perceptual recovery. So these are the results obtained by this lady, also in an Italian study, where you can see that's basically a resting questionnaire called the REST-Q rating, where you have different domains that you can see here. And you have different conditions. So there were 3 conditions in this study: recovery with electrical steam, recovery passive, and recovery in water. And you see no significant differences at any time point between the 3 forms of recovery. But in these other studies, recently accepted, also in the International Journal of Sport Physiology Performance, on a simple scale of 20, where 20 means I feel perfectly recovered, 0 means I don't feel recovered at all, there was a greater effect of electrical steam, so that's perceptual recovery, 17 out of 20, which is a lot, more than water therapy, more than passive recovery. And that's quite important, and the difference is very large. So if we conclude about the perceptual function, perceived recovery, out of 4 studies, 3 show that electrical steam is more effective than passive recovery, and 3 out of 5 studies show that electrical steam is more effective than active recovery, mainly. So to conclude and to sum up, based on the evidence, electrical steam versus passive, first step. Remember, this is muscle strength. This is a perceived recovery. Compared to passive recovery, or sham, in some cases there is sham electrical steam is unlikely beneficial for physiological recovery. No effects. Electrical steam is likely beneficial for perceptual recovery when we compare electrical steam to passive. Now we compare electrical steam to active modalities. So compared to the other modalities, electrical steam is unlikely beneficial, only 1 out of 11 studies. For physiological recovery, electrical steam is possibly beneficial for perceptual recovery compared to the other conditions. So I think the message is clear. Physiologically, no. Psychologically, quite likely. Some considerations / recommendations. So you need to be careful with these studies. I think somebody made the point also about the quality of some studies. Very heterogeneous electrical steam procedure, subjects, exercise type, assessments, and so on. So you need to be very careful about those conclusions. That's why I preferred simply to make this graph telling you it is more or less effective without presenting mean, standard deviation, effect sizes. That's why I think we believe if you want to follow this pathway of electrical steam for recovery, are there any benefits from the perceptual part, which I can understand. I think we need a consensus paper and a meeting just to do that. We did very recently exactly the same for electrical steam for strength training. And I invite you to read these papers we published in a special issue of the European Journal if you are interested in the physiology of electrical steam, or even a booklet or a conference specific for PTs and strength conditioning coaches about electrical steam for recovery. The benefits appear to be greater when electrical steam is applied to muscles other than the quad, which I can understand very well. If you want to promote the pump effect, I mean, why do you stimulate the quad, which is very large, where the veins are very deep? I mean, you need to stimulate the tibial nerve, the posterior tibial nerve, or the plantar flexor muscles. The effects were better when electrical steam was applied for long time periods. So there is one study, is the MENS study, where it has been applied with a membrane for 48 hours with no stimulators. which is probably also an advantage because also you can keep it during the night. And also, electrical stim looks to be more effective in the presence of muscle damage. One more time for this perception of I feel less pain, I feel better. I feel I will not have an injury again. So the recommendation is deliver electrical stim distally. Why do you stay proximal? The quad is absolutely against the physiology. And the quad is, let's look at my first slide. That's what commercial people say, okay, big muscle, big, very good muscles, you need to stimulate the quad to promote recovery. I don't think so. I need to be more distal. And even the best application would be something like that, which is on the market for a few dollars now. This is positioned behind the leg, as you can see here. This can be kept for an hour, 10 hours, 3 days, a week. This has intermittent stimulations that are delivered to the common peroneal nerve. And these contractions can promote the muscle pump effect. This has been demonstrated in a study in the International Journal of Angiology. So it's quite effective. Or otherwise, as people do in Paris, stimulate, as in this case, the gastroc and soleus muscle, or even the popliteal vein at this level, at the foot level. That's the JAP study. But in any cases, that's not look very useful to me. Electrical stim, such as the one used for recovery, could induce spectacular training effects. So that's a very simple study made by the team of Dirk Pett from Germany. If you train and keep electrical stim 4 hours a day for 2 months at low frequency, as it is usually done for recovery, you will see a shift toward slow twitch fibers, as you can see here from muscle biopsy. You will see amazing changes in the enzymatic activity, so an increase in the oxidative enzymes and a decrease in the glycolytic activity, and a huge increase in the aerobic performance. And that's exactly what you obtain with rats when they receive chronic low-frequency electrical stim. So you have to be careful, and limit the excessive use of electrical stim for recovery. But I would like to remember you that the physiology of electrical stim is very poorly known, and few attempts have been made to verify the systemic effects. So these are the data obtained with this kind of device. These are the 3 steps I presented you to validate physiologically one form of electrical stim. And we know very well that there is no single device having demonstrated one by one that electrical stim can be effective from an increase in blood flow, as you can see here. Okay, first validation, very good. Let's move to the second one. Does this increase in blood flow promote metabolic removal? We don't know. Does this increase promote neuromuscular function? We don't know. We know that this kind of application has been successful with professional rugby players to promote perceptual recovery. Thank you very much.
It might be best now if we do have a few questions, and Professor Maffiuletti has probably just saved us a little bit of money on buying electrical stimulating equipment by the sounds of things. And it certainly is nice to hear the other side of this, because we often get salesmen in here telling us how it's going to cure everything from problems with your wife to your heart murmur. Do we have any questions? I think it was a very clear talk. Yeah?
I agree. I agree. I mean, the professional cyclist, when they do 7 hours in the Alps, when they do a Milano-San Remo and it's snowing like last week, they certainly prefer to be in the hotel and stimulate their legs, even if they stimulate here and they don't know it is not effective. But again, I mean, what we expect from that, if you know and if you understood a little bit what I wanted to say, is that that's simply placebo. So you can put the same electrodes here and say spectacular changes in the recovery of heart. Okay, let's apply that. And that's placebo, simply placebo. Physiologically, I'm very sorry. I mean, again, I'm not here to say you need to use or not, don't use, but physiologically, there is no evidence. And then in terms of the laziness or the cost for an athlete to say, okay, I want to cycle 30 minutes to do active, or I want to stay in a bath at 20 degrees, or I want to apply electrical steam in my room while I reply to my wife or whatever, I think everybody will tend to say, okay, I use stimulations. But then, I mean, it's also very individual. Some people really don't like it at all. Some people find it funny. For me, it's everything but placebo.
I'm a little bit conflicted here just before your question, because while I hate machines by and large clinically, we can't deny the placebo effect. And if the effect is real, and if I said there's this thing here and I won't tell you what it is, and it has an effect of this size and it does this and it does it in everybody, are you going to use it or not? Well, yes, I'll use it. Now I'll tell you it's the placebo effect. Oh, we can't use that then. If it works and it's a placebo,
I'm not saying.
Yeah, no, I agree with you. So this is kind of the internal conflict, that I would love it to have a real mechanism, a real physiologic mechanism, but if it comes down to it and I say, drink this holy water or sprinkle this stuff or do this and you will get better, and the athlete buys it and buys into it and it works, then to some extent we probably have to do that. A comment to this point or a different question?
I mean, I can only agree. I can only agree. But for me, everything around that is difficult to explain because, again, it's not physiology. It's simply seeing one person, okay, like this one. If you see in magazine and on the TV that Mark Cavendish is using electrical steam, it's not the same as if you are seeing if myself, I am connected to the current. We agree, but this has an effect on people who buy a stimulator for that, also on athletes. And the good thing is that, I mean, at least from Greg data, only 20% of teams use electrical steam. And I think it's also a matter of time, because there have been a time, let's say 15 years ago, when electrical steam has been used a lot for strength. There was the belief that it was possible to increase muscle strength more than voluntary exercise. Now it's not anymore true, and thanks God, we know it's not true, it's even dangerous. It's complementary if you want to do some specific things, but it's not better. Now we are in the phase where, okay, commercials have seen that it's not very effective for strength with athletes. Okay, let's focus on recovery. And that's something, I mean, from the physiological side, ununderstandable, at least for me.
According to the frequency of electrical stimulation, can you say that the low frequency is leads to the dopamine effect, and so that it will lead in your pain relief, or in the lead to the state of muscle spasm or contraction after overload or after gain.
Mm-hmm. Okay, one more time. People believe that frequency can do a lot of things. So low frequency, slow fibers, high frequency, fast fibers, it's already something impossible. Low frequency endorphinic effect, high frequency not. Again, it's not true. I think the second paper in Science in the 67, they used TENS at 100 hertz, which if we use our definitions, it's high frequency already. And they had the largest increase in endorphinic effect. I don't think nobody ever demonstrated that there is a best frequency or a best application for promoting pain-related adaptation to electrical steam. And the same for the, the shape of the pulse, the duration of the pulse. So it's really nothing but confusion. And I only refer to one paper made by Rick Lieber, who is one of the best physiologists in the world, who published in a paper in physical therapy in the 80s, clearly writing that none of the parameters you use have an effect on the effectiveness of electrical steam. The only important thing is your anatomy, how excitable you are, and how well you can excite terminal axon branches, because that's actually where the contraction originates. When you apply the current, we don't stimulate directly the muscle. We excite the distal part of the nerve efferents. And I think that's the point. So that's nothing but anatomy, individual factors that cannot be predicted, and changing the shape of the pulse from triangular to rectangular to whatever. As you can see from all the new devices, they all have a new shape. This doesn't do a lot on how we activate muscles. And maybe I have not been very clear about the main limitation of electrical stim. So even before doing this talk, I cannot conceive how, when you apply current, let's say to the quad, where we know very well that even when you suffer 10 out of 10 on a pain scale, that you apply the maximal current you can tolerate, and you produce 30% or even more of your force when you stimulate a muscle, you are only activating 15% of the muscle cross-sectional area. So it's very incomplete, the recruitment. And I don't see how recruiting only a part of a muscle, and especially the superficial part, where also more likely for the quad fast fibers, you can promote recovery. That's a nonsense to me. If you increase the intensity, the current goes deeper, but then it's more discomfortable. So in animals, it is possible. In humans, in vivo, it's very difficult to find ways to minimize the pain, besides using it 3 weeks to reduce, to improve the tolerance. That's something possible, but for athletes, that's not very good. I mean, according to blood flow, depending what you're looking for. But if you want to improve blood flow, voluntary contractions are much better than electrical stim. One more time, because you activate more muscle. One more time, more distal than proximal. So if you do, I mean, that's the paper in Journal Applied Physiology. If you do this kind of exercise, that's what people ask you to do in a plane, and actually that makes sense. You increase much blood flow. You have the maximal increase in blood flow you can obtain. And electrical stim, I don't think it is really beneficial for that. And that's why the physiology behind electrical stim for recovery doesn't make a lot of sense. Don't say any sense.
Yeah, we can do maybe a link with the lack of evidence with the compression guns as well.
Mm-hmm.
It is most of the paper just focus on the perceptual recovery and the okay, it works, less lungs, problems, etc. But essentially, it's less than 1% efficiency during exercise. And then, in your opinion, is there a kind of specific time window during the recovery using the electrostimulation like the compression gunners, because it obviously is more effective in recovery than during the exercise itself? And then what do you come on specifically on recovery in terms of technology?
Okay, so I have no clear response to reply to your question. What I would recommend, because there is no evidence, what I would recommend is that because it is perceptual, so it is according to what you feel, and if a soccer player has to do some form of recovery so that he feels protected, so his fear of injury or fear of not doing recovery, that's everything but that for me, then the player decides if it is an hour after the competition exercise bout or 3 hours after. I mean, that's nothing but perception. So that's the best time window for him. Physiologically, I don't think there is a best time window. Perceptually, I think if the player or athlete decides on his own when is the best time, then, I mean, again, to strengthen the placebo effect, you can say, no, it's an hour after for everybody. Then I can understand. But I will leave it free for the players.
There is no link with adaptation. That's it. Because if you're looking at very low or very steady-state values, it means that it's not dangerous if you would like to promote adaptation instead of recovery. Then you can use it finally when you want, even if it's only perceptual.
I agree. So the athlete decides for me.
Yeah.
Mm-hmm.
Sometimes.
guess perhaps the only other thing to weigh up is while you're doing this nonsense treatment, you're not doing something else. So if there was something else that we could be doing, yeah.
I mean, in all cases, I don't think that's the magic pillow. In all cases, I think that's part of a very complex process, a very complex interaction between different modalities.
Yes.
And I mean, I didn't have time to speak about all the other application of electrical steam, but if you give a stimulator to somebody and leave him free to use it, that can be also very dangerous. There are many single cases of people, including one athlete, with muscle troubles, muscle problems, because of excessive use of stimulation. I mean, that's another story. And I think by using excessive intensities, so when it is too high on this curve, when you are very high on the motor part, you can create a lot of fatigue. Because one more time, you are activating few fibers that are superficial. And if you increase the intensity and have those fibers shaking and producing high forces, you are creating fatigue at a rate that is 5 times faster than a voluntary contraction. So that could also be negative for recovery if you actually use excessive intensities.
Last question.
Welcome. I will summarize. No. There is a very recent meta-analysis on TENS made by Zluka and collaborators, Journal of Pain 2005, I guess, where for different kinds of pain, so we don't speak about recovery, we speak about pain treatment, osteoarthritis, pain due to muscle problems, whatever, in tons of populations. I think out of 250 studies, maybe 15 showed a significant effect of TENS. And the main conclusion of this meta-analysis was there is no, even from the clinical side, there is no clinical effectiveness of TENS, even if we speak since 1965 about this gate control theory, which is neurophysiologically a valid theory for pain. The endorphinic hypothesis is as well an hypothesis, because you can imagine that it's not something easy to demonstrate in humans. So clinical effectiveness, very unlikely. Welcome.
Well, let's thank Professor Maffiuletti one more time.